from the audience. Hello. On the occasion of World Hypertension Day, I present to you some facts related to hypertension, after which I am here to resolve some queries that you have about this disease. Hypertension in common parlance is known as high blood pressure. It happens when the pressure in our blood vessels increases beyond a particular safe limit. And when it increases beyond that limit, then it can cause problems. The thing about hypertension is that it is known as a silent killer. It doesn't cause any symptoms in most patients, like say 50% of the patients, unless there is some damage to the heart, brain, kidneys, or eyes. Hence, it is necessary that hypertension is detected early and remains well controlled. Nearly 50% of adults are known to suffer from hypertension. 1 in 2 adults, that is. And the recent trend that we are seeing is that hypertension is also affecting the young as much as it is affecting the elderly population. From here on, I invite questions related to hypertension. So till we await the questions, let me tell you the types of hypertension. Hypertension can be what is known as a primary hypertension, which happens because of the normal aging process. It is usually the disease of the elderly people. Primary hypertension is also called essential hypertension, and it is basically a sorry, and it is basically a disease which can be treated with antihypertensives. Whereas the other type of hypertension is secondary hypertension, which requires not only antihypertensive medication but also investigations to find the cause of the hypertension. This usually secondary hypertension means the hypertension is secondary to some underlying problem. It can be thyroid or some sleep related problem or because of some medication. So workup for the underlying problem of hypertension is also essential in addition to treatment with antihypertensive medications. So, what are the signs and symptoms of high blood pressure? High blood pressure largely presents as no symptoms unless with complications like I mentioned before. But some people can experience symptoms in the form of breathlessness, palpitations, that is the sudden feeling of one's heartbeat, or headache or giddiness. These are some common mild symptoms of hypertension. Whereas when it causes complications in the heart or in the brain, it can come with unconsciousness, very severe headache, very severe giddiness, chest pain, and breathlessness. When it affects the kidneys, it can come with swelling in the whole body or reduced urine output. And when it affects the eyes, what we call as hypertensive retinopathy, the patient can come with reduced vision or flashes in front of the eyes. So how frequently should we check the blood pressure? Now, after the age of 30, we recommend that blood pressure should be routinely screened annually in every patient. It is a very simple method in which we just apply the blood pressure measuring cuff and we get the blood pressure. So it's a simple office procedure. So that is something which can be done without much of efforts. So we recommend routine screening above the age of 30. And in patients with a strong family history of hypertension in both parents or young hypertension in parents, we recommend screening even earlier. In patients who are diagnosed with hypertension, we recommend that their blood pressure should be checked at least once in every 3 months. That is when they should be consulting their doctor also. So, 4 times a year, a doctor visit is mandatory for adjusting and checking the blood pressure as well as the blood pressure medications. So whenever hypertension is diagnosed, it is basically like I said, in elderly people it is easy to accept the diagnosis of hypertension because it is usually essential hypertension, which happens because of increased vessel wall stiffness of the blood vessel walls. So when in primary hypertension or essential hypertension, the tests that are to be done are to look for the end organ damages. That is, which are the organs that can be affected by high blood pressure? Those organs have to be screened. So, the organs that are affected are the heart, brain, eyes, and kidneys. So, mandatory tests include renal function test, checking for the ECG, 2D echo, a retinopathy screen, and checking the urine for leakage of proteins. Simultaneously, hypertension being a lifestyle disorder can also present with a patient can also have coexisting diabetes. So diabetic screen also becomes a must as does a screen for lipid disorders. There are variety of medications available for the treatment of high blood pressure. Most of these medicines are generally free of side effects. In fact, the beauty about these medications is that unlike the diabetes medications which might lower our sugars to very low levels, blood pressure medication will not ever lead to low blood pressure. From high to it will bring us to a normal blood pressure. So there are wide variety of medications available, different classes with different mechanisms of actions, and depending on the patient profile, whether they are elderly, whether they have coexisting diabetes, whether they have swelling in the feet, whether they have increased heartbeat, depending on that, the blood pressure class will be chosen by the doctor. In stage 2 hypertension, that is very high blood pressure, we usually prefer more than one medication. In stage 1 hypertension, we prefer a single agent. Whenever the high blood pressure remains uncontrolled, it means there is persistent load on the heart as well as the blood vessels. So, if the blood pressure remains uncontrolled, then it can lead to sudden intracranial hemorrhage in the brain, what we call brain hemorrhage. It can lead to heart attack or it can lead to reduction in the kidney function leading to renal failure. So, these are some complications of high blood pressure. So avoidance, yes, prevention is always better than cure. So in avoidance of high blood pressure can be done by two approaches, dietary and lifestyle modification. So when we say dietary approach, having food with high salt content, high sodium chloride content is definitely prohibited. So where do we get this concentrated salt in pickles, in papad, wafers, and top salt that we put, all the processed food, all the food with preservatives, they contain very high levels of salt, which can actually cause a spike in the blood pressure. So definitely a salt restricted diet will be important. Secondly, keeping your weight in the healthy range because obesity itself is a risk factor for hypertension. So that keeping the weight in the healthy range by eating high fiber, high protein, low fat diet will be important. The other limb here will be to go for regular exercises. At least 30 minutes of brisk walking or any physical activity 5 times a week is recommended to keep your heart health in a good, desirable range. So, if the person, then hypertension is actually classified as pre-hypertension and hypertension. So, if the person is even found to be in a pre-hypertensive range, that is not above 140 of the upper blood pressure and not above 90 of the lower blood pressure, then we suggest that the patient should get rid of habits that are harming them, like smoking, alcohol, late nights, getting inadequate sleep, not resting enough, getting enough rest. All these habits can be avoided dietary modification, like I said, the DASH diet, dietary approach to stop hypertension, a low salt, high fiber diet. These are some natural ways to control blood pressure. But we should exercise caution here because if the blood pressure remains uncontrolled in spite of the lifestyle modifications, then we should definitely go for pharmacotherapy. So there is no oil that will prevent hypertension because, of course, healthy oils are the oils which have a good ratio of omega 3 to omega 6. So definitely there is nothing called as like a best oil, but anything in moderation is good. Like having the polyunsaturated fatty acids, the PUFA, avoiding the saturated fats. These are some dietary modifications that we can definitely follow because that will indirectly benefit our weight. And when the weight is under control, the chances of developing high blood pressure is less. So it also depends on what time of the day the blood pressure has been checked. Like if it is, if the blood pressure can rise due to several reasons. During the day, there is a lot of variation. Especially after meal, the blood pressure can be high because then our metabolism is on faster rate. And then it can also happen when the person is on full bladder, when the person has not rested adequately, when the person has just exercised. So if the blood pressure is 120 by 80 one time and 145 by 95 another time, so the best thing to do would be relax for half an hour and check the blood pressure again. So, in spite of that, if it remains persistently high, then I would suggest that you should get a 24 hours BP monitoring done. There is a simple test called ABPM, ambulatory BP monitoring, in which the blood pressure cuff is tied to our hand and the machine monitors our blood pressure hourly for the 24 hours, and we know whether the patient is having real spike in the blood pressure throughout the day. It is like a videograph of a blood pressure. Any side effects of IBP medicine. I always tell my patients that the side effects that you will encounter will be more because of not keeping the blood pressure under control. So none of the medications are with major side effects. There is amlodipine, there is cilnidipine, which causes some degree of swelling around the ankles. There are some medications which can affect our potassium a bit, but I'm sure whenever new medications are initiated, the doctor would definitely advise a close follow up and a watch out for development of any minor complications. But largely, like I said, if we see the larger picture, having an uncontrolled blood pressure will be more of a side effect than having a medication to control the blood pressure. I guess that's the end of the session. So, my concluding remarks are that we should uh, engage in a healthy lifestyle with the five best friends, that is adequate sunshine, be as close to nature as possible, drink lots of water, eat healthy, get adequate sleep, and learn to manage your stress. Thank you.